Hi, I'm Sam. I'm an NHS patient, but I'm also part of the Patient Forum for the Periodontal Society. And I'd like to know a little bit more about gum disease.
Oh, lovely to meet you, Sam. Thank you for introducing yourself. My name is Zehra, and I'm a dentist by background, and I work in a hospital in Birmingham. And I'm also an academic, so I do lots of research as well. And my PhD was looking at the links between diabetes and the role of the oral healthcare team.
Right. Yeah, my mum's pre-diabetic, and I don't know the link between diabetes and gum disease. Could you explain that?
Yes, certainly. So the link between diabetes and gum disease, which we often call periodontitis, which is an irreversible form of gum disease, is now actually quite strong. And we know that the relationship or the link goes in both ways. So if somebody has diabetes, there's a chance their gum health will be worse. And if they have gum disease or periodontitis, it can impact on their diabetes as well.
And when you say it's irreversible, is there any way of slowing it down or stopping it?
Certainly. So with people who have gum disease, we talk about their risk quite a lot, and we talk about how we can manage their risk. And there are various risk factors that are involved. And this may be something like smoking, which we can ask our patients to try to stop, or it may be to do with their oral hygiene practices, and we can give them advice and tips and tricks on how to improve their home care regime to make sure they're cleaning their teeth in the most effective way below the gum line and cleaning between their teeth to reduce their risk of further bone loss.
What sort of tips can you give?
So generally we talk about techniques around brushing, making sure you angle your toothbrush in the right way beneath the gum line in order to make sure you're clearing away the soft bacterial deposit that builds up on the teeth.
Is that plaque?
That's plaque, exactly. And we also talk about effective methods of cleaning between the teeth using appropriate brushes, floss, or interdental cleaning aids to make sure that you're not just removing the plaque from the front and the back surface of the teeth with brushing, but also between the teeth with interdental cleaning too.
I don't really get on with brushes. Is floss as good or?
So in terms of individual advice, without physically looking, it's hard to say what's best where. If you're finding it's difficult to get brushes through, then certainly floss is an option. I normally advise patients to speak with their oral healthcare team provider to show them in their own mouth what works where. Because even when we recommend brushes to patients, often patients will say to me, I use the blue one or I use a red one.
Okay.
But actually, very few people need one thing across their whole mouth. We generally advise using the correct fit, right size, so you have multiple brushes or floss throughout the mouth generally.
Yeah, my mum's got a few different colours. I think she uses blue and red. I use electric toothbrush. Is that the best thing to do?
So an electric toothbrush is absolutely fine. Yes, there's evidence that electric toothbrushes can be more effective. However, I do say to the patient, with the correct technique, they can achieve an adequate and effective brush using a manual brush. It's just your technique is needing to be that much more better, if you like. You have to have the exact correct technique when you're using the manual brush, whereas an electric brush, though it is technique sensitive, it will do some of the work for you. So it can make things a little bit easier.
So I was told at school, just down for the up tooth and up for the bottom teeth. But I still do that a bit with my electric toothbrush and make sure that I go over the gums as well. Is that right?
Going over the gums is certainly correct. So we like to keep the bristles at about, we say almost a 45-degree angle, so coming down towards the gums as you suggest. So cleaning at the gum line there, making sure that we're removing that plaque or that soft bacterial deposit from where the teeth and the gums kind of touch each other.
Okay. And what are other connections with other things? I heard about psychosocial links with
So in terms of gum disease, it's really important that we help our patients to manage and control the disease for various reasons. So in terms of nutrition, when patients are eating, they're going to have higher quality and quantity of food and variety of foods if their gums and their teeth are intact. So it's important to maintain teeth from a nutritional point of view. In terms of function, with your teeth and your gums intact, It can affect your speech and your ability to talk and to eat. And you mentioned the term psychosocial well-being. Well, what we mean by that really is your gum health and the health of your teeth can really impact on the way you as an individual patient think and feel. So I'll give you an example, if I may. I've had patients come and say to me, because of the way that my gums look, I'm too self-conscious to meet friends to eat out in public.
Right.
And therefore I avoid going out for meals or social events with my friends because I'm embarrassed by my teeth. And that would be a negative psychosocial effect of having gum disease. And other examples are people who say, for example, things like, I don't want to smile at my child's wedding because I'm embarrassed by the appearance of my teeth. And these sort of things would be psychosocial effects of gum disease.
I can relate to that. So I knocked out my front tooth, one of my front teeth, on my bicycle handlebars, and I had a tooth on a post, but it after a while it kept falling out, so I just walked around like a pirate, which I got used to and my friends got used to. But now I've got a new one, and I can smile again more confidently.
Well, I'm glad to hear that's been resolved for you.
Thank you.
So, yeah, so for these sort of reasons, nutrition, function, speech, the psychological and the social benefits of maintaining teeth, it's really important that we help patients manage their gum disease in a way that's appropriate. But the thing that's really close to my heart and that's really important to me is the link between gum disease and general health. Because, as I say, I do research, and a lot of my research was around the way the oral healthcare team can help patients to identify their risk of diabetes. And we know that diabetes is strongly linked now to gum disease. So it's something that I think is really important for patients to understand. Managing your gum health has lots of benefits, not just the retention of teeth.
So it's a lot to do with nutrition.
Partly to do with nutrition, but also the association between the diseases is partly linked to the inflammatory process that links the two conditions. And also in patients who have gum disease, if you imagine sort of my arm is the root of the tooth and you've got the gum that sits quite tightly, where we have gum disease, that gum becomes a little bit looser. And the soft bacterial deposit can migrate beneath the gum line onto the root surface, and where the destruction process happens in gum disease and the gums break down, some of the bacteria and their products can actually enter the bloodstream, circulate to the rest of the body and cause other problems. And this is why we think that gum disease may be linked to things like diabetes, heart disease. There's emerging evidence for it linking to things like lung disease, kidney disease, and even dementia.
Crikey. I didn't know that there were so many things that can be linked to basically how you clean your teeth.
Yeah. No, so there's more than 50 conditions, I believe, now that have shown some level of evidence that there may be a link between those inflammatory conditions and gum disease. The ones with the most strong evidence to support them are certainly diabetes and cardiovascular or heart disease.
Right. Thank you. It's quite enlightening. I'll make sure I'm a bit more diligent with my dental floss. I've found it really quite interesting, and I've learned a lot, but I haven't got a great memory. So if you've got any information written down that I could take away.
So I often signpost my patients to the BSP website, and on the website they've got bespoke patient-centred resources, and there's several leaflets there that are really interesting about not just periodontitis, but actually the links between periodontitis and systemic health.
Brilliant, thank you.